very welcome to a new brand story here on ITSP Magazine. This is Sean Martin, host of the Redefining Cybersecurity podcast. I'm coming to you live from HITRUST Collaborate 2024. An amazing week of great conversations and collaboration, of course. A ton of innovation, ton of partnerships, and we're going to talk about one of those partnerships today. And I'm thrilled to have Walter Haydock from StackAware and Steve Dufour from Embold Health. And we're going to talk about how they came together and leveraged HITRUST to deliver great outcomes for the healthcare community. So before we get into what you actually did and how you did it and why it matters, a few words about what StackAware does and then your role in the company as well.
Sure. So StackAware helps AI-powered companies measure and manage their cybersecurity, compliance, and privacy risk. I am the founder, CEO, head of engineering, janitor for StackAware.
We are all the above.
Yes, we are currently a one-employee show. You're looking at them, and we have contractors that we work with, some advisors external to the company. But yeah, that's us.
And you use AI.
We do. We are heavy users of AI, and we are one of the first ISO 42001 certified companies in the world.
Look at that.
So our AI management system has been formally audited and certified.
Fantastic. Stephen.
Yeah, I'm Stephen Dufour. I'm the Chief Security and Privacy Officer of Embold Health. Embold Health rates physician performance. We rate providers on the appropriateness and effectiveness of care. The idea is if we can get patients to higher performing doctors, they will have better outcomes. And the idea is to save money, save time, and save and to stop needless procedures.
And readmissions and all the other crazy stuff that comes along with it, right? That we all pay for.
Exactly.
Right. The other thing we pay for indirectly is getting compliant and raising the security posture and all this other stuff that's necessary because as a patient, we want our information protected. But we also want to get the care that you're talking about. In your presentation, it struck me that you led off with what are the outcomes we're trying to achieve with this partnership. So can you start us off there? I think you touched on a little bit here, but if you can maybe expand on what the objective was by coming together and leveraging HITRUST to
Sure.
deliver a solution.
At the very beginning, and it's Embold's mission to improve healthcare outcomes, right? And we wanted to leverage generative AI to help in that mission. And we wanted to do it responsibly. So part of the business...
Can I pause you there?
Sure.
Because we want to use technology to do something, or we need to do something, and the best way is to use technology. Can you describe that thought process? Of how you
as far as like the business problems versus objectives? Yeah. Okay. Yeah. So the original business problem we solved it through technology and data. So we developed a methodology for rating providers. We developed a product called Provider Guide to allow people to log in and find highly rated physicians. But we also realized there was another problem to be solved. Our end users needed to know what type of provider that they need. So we wondered if we could use generative AI to help them find providers to solve that business problem.
Yeah, because there's tons of different practices, right?
Right.
So which one's going to help solve? And maybe you need more than one, perhaps.
Right, and they all have very funny names.
That's right. So on my show, I have this vision of having an understanding of what we want to do. We can actually leverage security to achieve it versus not understanding security and looking at it only from a risk perspective. We might not ever achieve the outcome we want because we're too afraid. But it sounds like in your case, you saw the desired outcome. You found a way to not just leverage technology, but in a way that's secure, which will come to you, Walter, here, to embrace it in a way that could get you to that outcome in a rapid time. So I don't know, can you talk to your engagement with Embold and how that process came together for you?
Sure. So Steve, as Chief Security and Privacy Officer, has an incredibly wide remit. He's responsible for everything security and privacy at Embold. And, for a small team, that's a huge domain of things that he needs to tackle. He's responsible for HITRUST certification. He's responsible for relationships with clients. So what StackAware does is we are specialists in AI-powered technologies. So when they were developing the Embold virtual assistant, which is their AI product, Steve got in touch with me to discuss doing a risk assessment and penetration test of their application. So what we did was do a top to bottom review of its security and make sure that it aligned with their business objectives and risk appetite.
And Steve, can you paint a picture of, I don't need the sausage making description, but kind of a view of this AI enabled app? Did you roll your own LLMs? What's the data source? That maybe a picture there so folks can kind of get a grasp of what you actually delivered. So maybe somebody who's looking at this as well can line up with what you're looking at.
Sure. Our data source is our data, our proprietary data. So we subscribe to a national data set that allows us to use our proprietary methods to rate all of those physicians. I was going to say on top of that, but it's a separate thing. This large language model using Azure OpenAI, our product, the Embold Virtual Assistant. It's an interactive tool that an end user can use. So for example, hey, my knee hurts or something like that. Then they'll ask it questions until it gets enough information to recommend a provider. And that's really important wording, recommend. Like you might want to go see this particular physician based on the symptoms that we just talked about.
Does it keep the history of the conversation? I'm assuming it's conversation like with the app. Does it keep a history so a collection of queries might change the recommendation path based on, there's a new set of symptoms. This actually leads us to a different area of treatment? Or
yeah, one of the things of concern is a history of conversations as well as interactions within our tool. We chose to use Azure OpenAI and a particular model that doesn't learn, and it doesn't store that information long term. So protecting our patients' confidentiality as far as the conversations go, very, very important in the development of this product. So our tool does not learn.
And so to me, that's a product requirement.
Yes,
right?
Yes.
So was that something you defined, or did StackAware help kind of frame the scope of what's possible?
In the beginning, we had a discussion. And we ended up talking about risk, right? Is it worth it for these particular models that can learn versus can learn? And what does that look like? What kind of third-party dependency does that create?
Anything to add there?
Yeah, I think the approach that Embold takes from a data security perspective makes a lot of sense. They don't train on the inputs from the patients who are seeking providers, while at the same time using the Azure OpenAI service, they can keep the context window open for the conversation. So within a conversation, the AI model can have short-term memory, like Steve mentioned, but not long-term. Essentially, Azure has a 30-day retention period. After that, it's gone, completely wiped. And I think, I agree from a security and compliance perspective, that's the way to go.
And it's really about managing your risk and what you want to deal with. So when companies gather information and data that don't meet or are justified by business requirements, it makes no sense. It puts the company at risk.
So how and where did the risk conversation come in? It sounded like early on, which is great. Did that continue throughout the development and delivery process and your role at the beginning and throughout the assessment as well?
Yeah, so we took a two-level approach. One, we did a comprehensive AI risk assessment for the entire company, looking at policies, procedures, vendors. I mean, today, every vendor is trying to integrate some sort of AI technology into its products, which can introduce productivity gains, but also risks if they're not managed appropriately. So we did that high level review across the entire company to make sure that Embold's stance with respect to AI matched those business objectives and was within their risk appetite. And then more specifically for Ava itself, we conducted a penetration test against it, attempting to inject malicious prompts, attempting to misuse it from a requirements perspective. So, making it do things it wasn't designed to do, evaluating some of the functionality. For example, there are off-ramps built into the system for folks who may be facing a medical emergency. That's not the type of thing you want to set up an appointment for if you have numbness in your left arm, shortness of breath, blurred vision. That's an emergency. So the system is designed to end the conversation and say, this is an emergency, call 911. Don't try to set up an appointment with your doctor if that were to happen. So we evaluated those situations, from kind of a malicious attack perspective, but also from a innocent user who simply didn't understand the gravity of what he or she was facing at the time. And then we also did a application penetration test of the underlying infrastructure to make sure that there were no vulnerabilities that could be exploited easily there.
And so I want to get to the reporting and the demonstration of protection and security that you did this work in a second. But I want to stick with the product requirements for a second, because every time I have a conversation around AI and we're going to build something using it, I used to be a product manager, and I could fairly well define the scope of what I wanted my thing to do. And if you just blindly throw AI on top of that, it's almost like an endless set of scenarios, right? User scenarios. So how did you come up with just even that example of, depending on the symptoms, you need to off-ramp them and get them some help immediately, right? Are those scenarios that you had in mind, and how do you contain the now AI-enabled app to not stray from scenarios that you don't want to exist? Or I don't know if I'm making sense or not, but to me it seems super complex.
Like with any product, despite being artificial intelligence or not, you have to define what it is there to do. So first and foremost, you have to describe the problem that it's trying to solve. Second, okay, we're going to build a product and it's going to be designed to do, let's say, 3 things. And then you should be able to measure if it's doing those 3 things. And then outside of those 3 things, you should probably stop, right? It's going beyond the scope of what it was designed for. So for the case of the Embold virtual assistant, we have 2 scenarios, and only 2 scenarios. Anything outside of that, the large language model on the back end is designed to redirect the user back to its intended purpose. The 2 scenarios that we grade ourselves on are emergency versus specialty. So the tool is designed to recognize emergency scenarios, right? My left arm is numb, my vision is blurred, right? And it will prompt you to seek emergency help and end the conversation. The next are specialty based. So if you describe headaches, blurred vision, but it doesn't recognize it as a scenario, it might recommend that you go to a neurologist. And so based on those 2 specific scenarios, 1, emergency recognition, and 2, specialty recognition, we can actually grade the effectiveness of the tool. And because we did that, we can also improve over time.
So how much of this did you test and validate internally? How much of this, clearly you did some of the risk stuff as well, but how much of this were you involved in kind of the user scenario?
So what we did is Steve and the engineering team gave us a detailed set of their business requirements. And that's a hard requirement from StackAware's perspective to do any sort of engagement, because if we don't know what the app should look like, then it's going to be very difficult to test it. So he gave us a very clear set of requirements from a business perspective as to what the outcome should look like. And then we ran it through scenarios attempting to push and break the limits of the system given these constraints.
And talk to me about HITRUST's role in all of this. both from your perspective. I don't know how much HITRUST you have involved in your organization, but maybe you want to describe that too, but specifically around the app and what you guys worked on together.
Sure. Embold Health is a HITRUST certified company. We do the risk-based assessment, so we have the much larger assessment 1 year, and then we have the interim assessment the next year. So this is our 5th year, and because of the nature of our new product and the announcement that came last year, which is the AI risk management framework from HITRUST, we wanted to include this product in our scope. So I'm not sure when this is going to air, but on Monday we submitted, and Wednesday they approved it, so they can start going through the certification process. So we might be one of the first AI companies
For the AI cert, the new cert that was...
Right, exactly. With that in our scope, which is a big deal. So last year, when they announced all of the risk-based items for managing AI risk, we had a very long list to go through. So we added all of those risk assessment requirements to our risk assessment and started to take those requirements for the Embold virtual assistant assessment. And we use those to have conversations, like internally within engineering, as well as the executive team.
And what are those, I'm always interested in the conversations with engineering. How did the HITRUST risk assessment help you have that conversation? Did it include the language to help guide them on how to architect and design and code and whatnot?
As from a technical perspective, not as much, but from a risk perspective, yes, because some of the HITRUST requirements are identify the internal and external. Just forgot the word, so I'm going to start again. Internal and external context. There we go. All right. From a technical perspective, not as much, but from a risk perspective, absolutely. Where one of the requirements is the identification of internal and external context for your AI system, right? As well as some requirements for bias testing. Like the bias testing really boils down to underrepresented groups, right? We're talking about age ranges, like from very high, like the elderly, or the very young, or African American, or any of our underrepresented groups. And that gave them the criteria to test for.
Interesting. And let's talk about the ultimate outcome here. And I don't know, your involvement in some of the conversations, but getting buy-off from executive leadership and perhaps even the board to make an investment to do security by design from the beginning, and to make the investment to know you want to achieve the certification and demonstrate with reporting that this is part of our scope now. Difficult conversation in a lot of cases, right? To make that investment in money, time, people, partners. What was that conversation like internally, and how did you help perhaps make that case?
Yeah, so internally it was very easy.
Okay.
I didn't have like a doomsday story or anything like that. It's easy.
Well, no, it's good. I mean, it sounds like you have a mindset and a culture of doing this.
Yeah, absolutely. So Embold Health is a relatively newer company. They've been around, I want to believe, like 6 years or so. The executives are open to conversations about risk and how to mitigate it, right? It's pretty easy whenever you classify something as, let's say, a $200,000 risk, and then you lay out the plan to reduce that risk by half. It's like very easy conversation to have whenever we're talking about dollars. And also I take the methodology, I don't present risk to the executive team unless I have a plan to remediate it. You know, then they can potentially approve or ask questions, or for the most part, it's just informational. Me conveying information to the executive team.
Common story for you working with Embold, or do they differ, kind of the cultures and whatnot?
I'd say uncommon, but good, but uncommon in a good way,
yeah,
because something that Steve is very good at is mapping security projects and outcomes to business outcomes. I've literally seen him do the mapping. And the risk quantification piece comes into play because if you're talking to a CFO, a CEO, that person understandably is concerned about the bottom line, and that makes sense. That's his or her job to optimize for that. And risk management plays into that calculation because obviously these people understand that there can be damage from a customer trust perspective, a regulatory impact. Even if you're completely heartless and don't care about the individuals whose data might be impacted, there's still a business impact to be had. So that's of course not the case for Embold, but there is a way to express the risk and the risk mitigation achieved quantitatively, which I think is very important. And then also something that Steve said in expressing, talking to executives about risk and then presenting options. But in my opinion, and I think Steve can weigh in here, I think those executives who own a business unit or a profit and loss statement, those are the people who should be making the calls about risk management, not security and compliance folks, because they have expertise, they are advisors and can make recommendations about the most cost-effective way to tackle a risk. But at the end of the day, they're specialists in a niche, whereas a CFO, a CEO has a much broader remit, worried about cost, worried about dealing with clients, partners, the public, things like that. So those people are best equipped to make risk decisions, in my opinion, with the support of experts who can quantify and explain those risks.
Do you want to weigh in on it?
I agree.
All right.
That's a very good explanation.
All right, as we wrap here, I want to speak directly to the folks watching and listening. Perhaps, we'll start with you, Walter. Organizations looking at AI, maybe either a piece of advice you can share based on conversations you've had or a lesson learned from this experience for a good way to take that first step.
The basics apply whether you're using AI or not. And if you have a firm foundation in terms of data governance, classification, transparency, vulnerability disclosure programs, things like that are they don't require fancy tools. They don't require a lot of real expertise per se. They just require discipline and follow through and commitment from business leaders. If you get those things right, then the AI governance piece comes much more easily. So bottom line, focus on the basics. And when you move into deploying AI systems, the security, compliance, privacy picture will be much easier.
I love it. I'm going to be a little more pointed with you, Steve.
Oh.
More focused on the AI security cert. And your experience working with that and with the HITRUST team, you described it, the 2-day turnaround on approval to begin the formal process. Having worked with HITRUST and getting a certification for the company at large, what was the experience like with the AI cert? Did it kind of fit in well? Or was there some disconnect? Or how does that look?
So are we talking about the new AI certification? They just... Embold Health, that certification is different than the one that they started doing last year. So the AI risk management framework that HITRUST released last year, that's what we're doing there. I'm excited about the HITRUST.
Because we haven't started the cert yet.
Correct.
Okay.
Not yet.
Sorry.
Yep. I'm excited about the certification because it does present a very specific opportunity to get our product certified in the context of our artificial intelligence. That's pretty cool. And if HITRUST and Microsoft partner together, then we could potentially use that certification to help our customers.
So then the risk management piece then, how was that experience?
It was good. It was very clearly defined from the very beginning. The wording such as the internal and external context, the individuals, society, the business, and the groups that are at risk for artificial intelligence bias. Very clear cut, very clear path forward. and really helped Embold Health improve our artificial intelligence product.
So safe to say you got the outcome you wanted
Yes.
with the app, and the two of you, along with HITRUST, achieved that outcome together.
Yes.
I love it. Well, thank you both for joining me and sharing this story. I really appreciate it. I love to hear how technology can be used in a safe way to deliver better health. I mean, that's ultimately what we're all trying to do here, right, for our customers. So thank you, everybody, for listening and watching, and please connect with these two gentlemen and their organizations, and stay tuned for more here on ITSP Magazine. Thank you.